Welcome to the lower extremity. In this module, we will be reviewing the anatomy of the lower extremity. That is going to consist of the foot, the toes, the heel, and the ankle. To start off, I'd like to say if you understand the bones and the joints in the hand and the wrist, it's going to be very similar learning the bones and the joints of the foot. You're going to see some similarities. So, to start, the foot has 14 phalanges, 5 metatarsals, and 7 tarsals, creating a total of 26. Starting with the phalanges. So again, phalanges could be referred to as the fingers or the toes, but in this part we're looking at just the toes. So the big toe only has 2 phalanges, the distal and the proximal, where toes number 2 through 5 have 3 phalanges, the distal, the middle, and the proximal. Looking at the 5 metatarsals, each metatarsal consists of 3 different parts: the head, the body, and the base. One particularly that I want to talk about is the base of the 5th metatarsal. It expands laterally into a prominent tuberosity, which provides for the attachment of a tendon. This is also a very common trauma/fracture site. So as we can see in this picture right here, base of the 5th metatarsal, this tuberosity, so this area right here is a very common fracture site in a foot. Looking at the joints of the foot, again, they're going to be very similar to what we see in the hand and wrist, just the names are going to be a little bit differently. So, the joint between the distal and proximal phalange of the big toe is the interphalangeal joint. So same thing as in the hand and the wrist. Looking at toes 2 through 5, they have 2 joint spaces. The space between the middle and the distal is going to be the distal interphalangeal joint, or the dip joint, and then between the proximal and the middle is going to be the proximal interphalangeal joint, or the pip joint. Each of the joints at the head of the metatarsal is going to be the metatarsophalangeal joint, or MTP joint, and then each of the joints at the base of the metatarsal is going to be the tarsometatarsal joint. So we have 2 bones in our foot that are called sesamoid bones. They're going to be located right roughly at the head of the first metatarsal, as you can see in the picture here. These are pretty much floating bones. They're not attached to any other bone. They're just embedded in the tendons. They usually present near joints, and these sesamoid bones are going to be found on the plantar surface of the foot, so on the bottom portion of the foot. Looking at the tarsal bones, we have 7 tarsals. We have the calcaneus, which is our heel, the talus, the cuboid, the navicular, and then we have 3 cuneiforms. We have the medial, the intermediate, and the lateral. So this is going to be the medial, intermediate, and the lateral. So the calcaneus is going to be the largest and strongest bone of the foot. It's often referred to as the heel. The posterior/inferior portion contains a process called a tuberosity, which is going to be a common site for bone spurs. So pretty much, again, here's the tuberosity. If we look at it in a lateral view, you're going to see kind of like a hook right here, which also will be referred to as plantar fasciitis in patients. The Achilles tendon is also attached to the calcaneus. The calcaneus does articulate with 2 different bones. It articulates anteriorly with the cuboid and superiorly with the talus. Also, you're going to see this picture in front of you. There's a lot of different processes, articular surfaces that you do need to memorize. So, unfortunately, yes, you do need to memorize this picture in front of you. Looking at the talus is going to be the 2nd largest tarsal bone. It's located between the lower leg and the calcaneus. The weight of the body is transmitted by this bone throughout the important ankle and talocalcaneal joint. So that talocalcaneal joint is going to be pretty much in between the talus and the calcaneus. It does articulate with 4 different bones: superiorly with the tibia and fibula, inferiorly with the calcaneus, and then anteriorly with the navicular. The navicular is going to be a flattened and oval bone located on the medial side of the foot. It's going to be located between the talus and the 3 cuneiforms. It articulates with 5 bones, posteriorly with the talus, laterally with the cuboid, and anteriorly with all 3 cuneiforms. The cuneiforms are going to be located on the medial and mid aspect of the foot. We have the medial, the intermediate, and the lateral. So looking at articulations, the medial is going to articulate with 4 bones. The navicular proximally, the first and second metatarsals distally, and the intermediate cuneiform laterally. The intermediate cuneiform articulates with 4 bones. The navicular proximally, the second metatarsal distally, and the medial and lateral cuneiforms on each side. The lateral cuneiform articulates with 6 bones. The navicular proximally, the second, third, and fourth metatarsals distally, and the intermediate cuneiform medially, and the cuboid laterally. So unfortunately, yes, you're going to have to memorize all of that. So take all of that into account. Last but not least, we have the cuboid, located on the lateral aspect of the foot, distal to the calcaneus and proximal to the 4th and 5th metatarsal. It articulates with 5 bones, the calcaneus proximally, the lateral cuneiform and navicular medially, and the 4th and 5th metatarsals distally. So this picture in front of you is looking at the arch of the foot. You have 2 different arches of the foot. We have a longitudinal arch as well as a transverse arch. Again, there are going to be some people out there that do not have a longitudinal arch at all, which usually people would be referred to as flat-footed if that was the case. But just note the arches of the foot do provide that strong and shock absorbing support for the weight of the body. Looking at the ankle joint, the ankle is going to be formed by 3 separate bones, the tibia, the fibula, as well as the talus. The expanded distal end of the fibula that expands alongside the talus is going to be the lateral malleolus. The medial elongated process of the tibia that extends down alongside the medial talus is going to be called the medial malleolus. These are pretty much 2 palpable areas that you can feel on your ankle. The inferior portion of the tibia and fibula forms a deep socket or a 3-sided opening called a mortise joint. This is where the superior portion of the talus fits into the ankle joint pretty much. Most hospital sites will do a 15-degree internally rotated AP oblique projection, which will open to demonstrate that mortise joint. Also something to note, the tibia is going to be the weight-bearing bone of the ankle, where the fibula, if you did fracture it, some people can bear weight on it, but if you broke your tibia, you would not be able to walk. Looking at the ankle in a true lateral position, a true lateral requires the lateral malleolus to be about 3/4 inch posterior to the medial malleolus, as you can see in this picture in front of you. The lateral malleolus does extend about almost an inch more distal than its counterpart, the medial malleolus. So for anatomy purposes of the ankle, please make sure you can identify all bony anatomy parts on both an AP view, which would be here, as well as a lateral view of that ankle joint. And that's it for lower extremity anatomy. Let me know if you have any questions.